Hi, Ron. Good afternoon. Hi, Ron. Good afternoon, everyone.
Hi, sir. How is Baguio City dealing with this crisis?
Okay, right now we continue to enforce the 24-hour curfew. Majority of the people of Baguio are cooperating, and we could say that we have a number of positive COVID-19 cases, and we also have increasing number of persons under investigation and persons under monitoring.
Can you give us those numbers, sir? The number of people, as we understand, there are only just 3 confirmed cases in Baguio City, but how many are considered PUIs and PUMs?
Okay, Ron, can you speak louder? I can hardly hear you.
Yes, sir. Can you give us a number, sir? How many are considered PUIs and PUMs in Baguio City?
Okay, for persons under investigation, we have 287, and these are under home isolation. For those admitted in the hospitals, we have 22. For persons under monitoring, who are under 14-day quarantine, these are 1,531. And then persons under monitoring have completed the 14-day quarantine, we have 542. At present, we have 4 confirmed cases, 2 positive presumptive cases, and 1 death, for a total of 7 positive cases.
Okay, so that's 4 confirmed cases, 2 presumptive cases, and 1 reported death.
Yes, definitely.
Okay, sir. How are you dealing with the? How are you implementing the measures there? You did say that residents of Baguio City have been cooperating with the local government, and that of course is good news. But what are the problems you are still experiencing there?
Okay, one of the biggest problems here is we still have some people who continue to ignore the enhanced community quarantine, and that's the reason why yesterday I ordered a lockdown of one particular barangay, that's Barangay Pinget, and then I warned 2 other barangays that they will be locked down if they continue to loiter around, if the residents continue to loiter around, and the barangay officials remain compliant. And this morning, when I did my inspection, all 3 barangays are strictly complying with the provisions of the CQ. Another thing is we're working on the market because we could see that based on my medical, my reading of medical journals, markets are basically one of the sites of the highest incidence of transmission. That's the reason why we came up with another scheme yesterday to practically reduce the number of market goers by as much as 50 to 60%. And I guess, we're having a successful, scheme this time, and I hope that we'll be able to sustain it for the next, we're looking at 3 months.
With the news reports that I've been hearing, sir, there are a number of measures that you have also been implementing aside from the prescribed regulations under community quarantine. Sanitation tents. You have been putting up those sanitation tents in different facilities in Baguio City. Tell us more about that.
Okay. First thing is when I tried to procure commercial sanitation tents, and only to find out that it will cost us about 220,000 pesos per installation, or per sanitation tent, rather. So what I did was to get in touch with the University of the Philippines because I heard that they are coming up with a design. So they provided me the design, and we came up with about 20 sanitation tents at a cost of about almost 8,000 per sanitation tent.
Wow.
So we were able to come up, I said, 20 sanitation tents, and these tents are distributed in the different hospitals and health centers and district health centers in the city of Baguio.
And these are placed outside before people enter those establishments, right?
Yes, especially those health workers who are exposed to PUIs and COVID-positive cases. Definitely, they are required to go through before they leave the site, they have to go through the sanitation tents.
And a
and
number
got
of
themselves disinfected.
yeah, a number of cities have also put up those sanitation tents. But where did you get this idea to put up those tents for Baguio City, Mr. Mayor?
I was reading some of the medical journals, and I found out that one of the best practices done in Korea, South Korea, and China and Singapore is the setting up of sanitation tents.
Aside from those sanitation tents, I've also read that you have a COVID-19 analyzer, AI COVID-19 analyzer. Is that correct, sir?
Yes, we call it the AI COVID-19 CT scan analyzer. And a friend of mine from Huawei gave me a call and explained to me that they were able to develop a system in China, and is now being used in the other parts of Huawei, of Europe, rather. And he offered me this, and they said that they have about that database composed of about 50,000 plus cases. And so that was in Saturday, and immediately I grabbed that opportunity. I told them that if they can, immediately proceed to Baguio. And in the afternoon, his team left Manila. And the following day, Sunday, last Sunday, we have all these hardwares and softwares installed. Monday, we do some carpentry works to isolate the CT scan room. And then Tuesday, we have the first field test. And initially, we had some technical glitch and hitches, but today, we were able to resolve everything. And in a matter of 7 minutes, you will be able to determine the result. Usually, with a higher speed, you can have the result in 2 minutes. But because of our internet speed, it's taking us about 7 minutes now. Yesterday it took us about 50 minutes to get the result.
How exactly does this work, Mr. Mayor?
Well, the CT scan of the lungs is sent to a system, and it's compared to the database that's in the cloud. And basically, the result will say high incidence of viral infection. It does not say COVID-19, but it says a high incidence of viral infection. And the final say would still be coming from the doctor. So this is not a confirmatory test, but it will aid the doctor in diagnosing a particular patient. And at the same time, you should understand that prevention, the key to prevention is early detection. So with this kind of system, you can immediately launch a contact tracing.
What are the protocols, sir? Is it the same protocols that is being implemented in a lot of hospitals right now, that those who are senior citizens and have underlying conditions and have severe symptoms, are the people only allowed to undergo these tests with the CT scan analyzers? Okay.
For the meantime, only persons under investigation. In our case, because this is the first time that's being done in the entire country, and we have started this here in Baguio, the protocol is the patient goes through the triage, and if it's determined to be a person under investigation, he goes through that system, and then he gets at the same time, he gets a swab, and then after that, we wait for the result of the analysis. Even if he gets a negative, we don't immediately inform him that it's a negative. You have still to wait for the result of the swab test. But if the result is positive in that system, we immediately launch a contact tracing. But we still have to wait. We inform the patient, we still have to wait for the result of the swab test.
How are the contact tracing efforts being done in Baguio City? Has it been effective? Has it been able to properly trace everyone that may have been exposed to those PUIs and even those confirmed cases?
Okay, it's the challenge. It's very challenging to do the contact tracing, especially if our contact tracers, we call them contact tracers, are merely nurses or medical practitioners. Because if you look at the dynamics of contact tracing, this is basically an investigative skill. So what we're doing now is to make sure that because of that limited skill of our contact tracers, we're making sure that each contact tracer or a group of contact tracers is being assisted by police investigators who are trained on cognitive interviewing. And now we're also applying technology in contact tracing. We're using a very, very expensive system, software, that are being used by police investigators. And with that, we'll be able to immediately create a link analysis and at the same time maintaining a database and determining the relationship per contact being made by starting from the main patient to the potential infected people or PUMs.
Mayor Benji, it seems like Baguio City is really going high-tech with this, but I do have to ask, did you have to coordinate with the Department of Health in using this technology, in using this equipment, the AI COVID-19 city scan analyzers, as well as your system for contact tracing and using the database? Did you have to get the heads up or the go-ahead from the Department of Health for this?
Okay, for the AI, we sought I conferred with the regional director of the Department of Health, and since it's simply a diagnostic tool, there's no conflict with the traditional DOH protocol. In the same manner that in contact tracing, it does not require us to coordinate with the Department of Health. As long as it is a system that will enhance contact tracing, I don't think we need to get their approval.
Okay. Now, how have the hospitals there prepared for the possible influx of the infected cases? You have more than 1,000 PUMs, just 4 confirmed cases as of now, 2 presumptive. But how have they been preparing, and how has the local city government prepared for the possible influx? Have you looked at other facilities as well to use with the possibility that more patients will be coming in?
Okay. Well, the big challenge here is usually the common scenario is that you convert as a hospital as your isolation area, and that's where you put in or you admit and isolate the COVID positive cases. And that is very dangerous. When I was reading the medical journals of other countries, I found out that this is not a good practice. And actually, the good practice is to make sure that there is a dedicated facility for medical care of COVID-positive cases. Right now, we only have DGH, and DGH is just so populated with patients. And putting another isolation area would endanger the other patients. At the same time, our health workers, our doctors, nurses, and
Right.
Utilities. So what we're doing now is finally we were able to look for an isolated facility. There's a former hospital in the city of Baguio that's no longer being used. It's Santo Niño. It took us almost a week to negotiate with the owner. Finally, the other day, the owner agreed and gave her approval. So we now have the exclusive COVID-19 medical care center. And in fact, we're working on it. Yesterday we brought in about 100 police trainees who cleaned the entire building. And for the past several hours, doctors were continuously meeting on how to really, operationalize everything. And hopefully in the next 2 weeks or on the 3rd week, we'll be able to, utilize the hospital, the care unit.
Mayor, thank you very much for sharing the best practices of Baguio City. We wish you well there, and I hope your residents stay safe. Thank you very much, Mayor Benji Magalong of Baguio City.
Thank you very much, Sean. Appreciate it. Thanks.
More news, local government units are being urged to set up more quarantine centers as hospitals struggle to keep up with growing COVID-19 cases in the country. Dr. Eddie Dorotan, the executive director of the Galing Pook Foundation, says LGUs need to step up as some hospitals have already reached maximum capacity. Dorotan appealed to local governments to convert establishments like hotels into quarantine centers to house patients under investigation and patients under monitoring. He adds this will empower barangay health workers to join the fight against the pandemic. The province of Laguna, home to about 3.5 million people, has 15 confirmed cases, with Santa Rosa City recording the highest number of infections with 6. Laguna Governor Ramil Hernandez says they are preparing one building at the Laguna Sports Complex to accommodate patients if local hospitals reach capacity. Let's now talk to Governor Hernandez. Governor, good afternoon.
Good afternoon po.
Governor, how are you dealing with the crisis there?
Sa ngayon po, lahat po ng resources po natin ay na kinakailangan gamitin ay ginagamit na po natin at tuloy po ang coordination natin ay kahit po sa mga kapwa LGU at kahit po sa mga private hospitals, nakikipag-usap na rin po tayo.
Sa ngayon po ba, medyo tumaas na nga po yung number of cases sa inyo, no? 15. Tapos nabalitaan ko po na meron pong recently sa Los Baños at Calamba. Meron pa po ba kayong dinadagdag na measures dyan sa probinsya ninyo para lang malabanan ng pagkalat nitong sakit na to?
So lahat po ng protocols po natin ay nanggagaling po yan sa national government. Then nagkakaroon po tayo ng enhanced version dito po sa atin sa lokal. So bawat munisipyo po ay nagkakaroon po ng kani-kaniyang version. Pero siyempre, ang trabaho ko po ay i-supervise na wala namang magiging overlapping or wala pong magiging conflict po sa order po na galing po sa taas.
So wala pa po kayong dinadagdag na measures, sinusundan niyo lang po yung protocols na binigay ng national government. Kamusta naman po yung mga ospital niyo dyan? Meron po tayong more than 6,700 PUMs, may mga PUIs po, 15 cases din. Overstretched na din po ba yung mga ospital dyan sa Laguna?
Opo, kahit nga po yung mga private hospitals po natin ay may mga napupuno na po at meron po naman mga hospitals na siyempre nag-aalala po sila dahil may mga iba pa silang pasyente na posibleng mahawa if ever. So ang ginagawa po natin dito, ang ginawa po natin sa Laguna ay nagde-designate na po tayo ng hospital na para lang po sa mga COVID patients and ginagawa po na kasama po sa plano siyempre kapag hindi COVID patients na pumunta doon ay kung saan po natin i-refer ng mga hospital.
Meron din po dito, nabanggit namin no, na yung Laguna Sports Complex ay kino-convert nyo na din po.
Opo, kahapon nga po ay in-inspection ko po at pinapalagyan ko na po ng mga gamit at lahat po, yung sa HR po namin, pinabubuksan ko na yung pong mga dating applicants po namin at pinapatawagan ko na para makapag-hire po tayo ng additional manpower.
Mm-hmm. Nakakausap po natin yung mga iba-ibang mayor at governors din po tungkol sa mga problema doon sa mga lalawigan nila. Sa inyo po ba, pareho lang din po yung problema? Yung mga tao po ba nagko-cooperate o patuloy po ang paglabas at paglabag ng quarantine?
May mga problema hong kaakibat o nanganganak pa ng another problema itong mga ganito po. So yun po minamanage po natin. Halimbawa po, may mga magkakalapit pong munisipyo na magkakaiba ang oras ng curfew. Kung meron po yung sa munisipyong ito ay pinapayagan ng ganitong oras, then sa kabila naman hindi pinapayagan ng ganong oras, then pagka po yung tao pwede naman po lumapag, bumili ng pagkain, kung paano po kung napatapat na conflict doon sa oras na ibinigay ng kabila. Kaya yun po yung inaayos natin na magkaroon sila ng coordination sa bawat isa. May mga munisipyo rin po na walang palengke. So kailangan niya pong mamalengke doon sa kabilang munisipyo. So dapat po kung ano yung patutupad na ordinansa sa kabila, coordinated po doon sa kabila dahil lahat po sila ay affected.
Paano po natin gagawin yun, Governor? Kailan ho kaya tayo magkakaroon ng mas maayos na sistema, lalo na yung koordinasyon ng mga munisipyo?
Nagbaba na po ako ng executive order. Kapipirma ko lang po ngayon at may mga pag-uutos na po akong binigay sa ating pong mga mayors. At kahapon po naman ay miniting ko na po sila. Gusto ko lang pong i-formalize yung aking mga napagmitingan. Kaya ipinut into writing ko na po. Nagawa na po ako ng executive order.
Napag-usapan po yung pamamalengke ng mga ibang tao dyan. Kamusta naman po ang food supply?
Opo. May mga ganun pong usapin. Meron po kasi nga kailangan lumampas ka pa o dumaan ka pa sa isang munisipyo para makapunta ka po doon sa kabila para supply po ng pagkain. So ang dami pong checkpoints. Sa kakulangan po natin ng manpower, hindi naman po lahat ng checkpoints ay may pulis. Ang karamihan po dyan ay mga barangay tanod. So pinagbiling ko po na dapat talaga ay knowledgeable yung mga barangay tanod na nilalagay nila kasi meron ho tayong national guidelines na sinusunod. Hindi po pwedeng kanya-kanya tayo sa bawat lugar. So lahat po ng mga problema ngayon ay tinututukan po natin.
Governor, finally po, ang pagkakaalam po natin, merong Anilag Festival dyan sa Laguna, no? Na-postpone na po, na iurong nyo to April 18 to 25. Tuloy pa po ba ang pagpaplano dito? At tuloy pa po ba yung festival mismo sa April 18 to 25 as of now?
Sa ngayon po ay hindi na po namin pinag-uusapan ang pagtutuloy po nito. Totally, kinancel na po natin nito. So depende na rin po sa mangyayari sa mga dating na araw. Pero sa tingin ko, sa laki po ng perang kailangan nating kastusin dito po sa krisis na to ay ngayon pong taong ito ay malamang na talaga na hindi na po yun matuloy kahit pa po malunasan ng problemang ito ng after mga 2 months or 3 months. Sa susunod na taon na po, malamang natin po isagawa po yan.
Laguna Governor Ramil Hernandez, maraming salamat po.